This is part 2 of the mini lectures for opioids, module 8. We will be talking about acute and long-term effects of opioid use. So opioids work in the brain by binding to the same receptors as our endogenous opioids. So you'll remember maybe from our first mini lecture that in addition to the naturally occurring and synthetic opioids, there are opioids in our bodies already. And they are called endorphins, enkephalins, and dynorphins. And these endogenous opioids are responsible for a couple different functions in the body, but one of them is the pain relief experience. And there are 3 types of receptors for those substances, the endogenous opioids, that are distributed widely throughout our brain. Those are the mu, the delta, and the kappa receptors. And those different receptors have slightly different functions in terms of what they do to our bodies. But the feel-good, euphoria, pain-relieving kind of effect is primarily due to action at the site of the mu opioid receptors. That's really where that sense of pleasure and that dreamy kind of euphoria comes from, is in naturally occurring endogenous opioids attaching to the mu receptor, but it's also where synthetic and or out of the body opioids, I should say, also attach. All 3 of the endogenous opioids share all 3 receptors. So there are many combinations of endogenous opioids and the receptor sites. And so they really do create a wide range of psychological experiences that we have. The pain relief and euphoria is really just one of them, but that can also be differentiated between the central nervous system and the more peripheral nervous system. There's different receptors and different endogenous opioid combinations there. If you're experiencing some kind of systemic pain, internal pain versus a peripheral pain. So they really are quite diverse and customizable to meeting our needs in the body. And so when external opioids are consumed, it produces a rush of pleasure, followed by a kind of nod or dreamy state. And again, that's why they're referred to as narcotics. People describe a sense of relaxed euphoria, just feeling really good and really calm. And what also is happening at the same time is that the central nervous system is slowing down. So breathing slows, the pupils constrict. Sometimes people experience nausea and vomiting as well. But it's really that slowing down of the nervous system that can also be very dangerous. So opioids slow down breathing. There are receptors in the brain stem. And so it's very bad to combine opioids with any other type of depressant because you might double up on that depressant effect on the central nervous system and really slow down breathing to a dangerous level. Because everything is also slowing down the depressant effect on the body, there is also a slowdown in the digestive process, and that can lead to constipation. So it's a pretty common side effect of opiates to experience constipation. There's also an increase of tension in the GI muscles. And this same process can lead to difficulty urinating. So it really affects the ability to eliminate both urine and feces from the body. So those are some of the short-term effects. Another short-term effect would be skin flushing or feeling an itchy sensation across the skin, and this is due to a release of histamines as a result of consuming opioids. And it is possible to experience short-term death by overdose, which could come from the slowed breathing, the depressant effect on the central nervous system, a decrease in blood pressure because of that depressant effect, or actually an intense and quick and a large release of histamines in the body can result in death, in just sudden. It's a somewhat of an allergic reaction that the person responds to by with their system shutting down. In terms of long-term effects, interestingly enough, it is opioids and chronic use of opioids is not super toxic to the body. So in terms of organ damage, in terms of how toxic the substance is, it really doesn't degrade your body system that much. And so your lecture question for this week is actually, given that that chronic long-term use of opioid doesn't really damage the body directly, what is it about long-term heroin use, long-term opiate use that does cause medical problems? And because you do see medical problems in people who are using heroin, but it's generally not due to the direct effects of heroin on the body itself. And so my question for you is, what is it due to? Long-term heroin use is associated with lower sex drive, impotence, and lower sperm count in men, and that's all due to a decrease in testosterone due to long-term opiate use. In women, it can lead to the loss of periods or amenorrhea. Chronic constipation and all that goes with it, just really backed up GI system. It can you can have impacted bowels, which are impossible to pass, and it becomes obstructed and needs medical intervention. General, like, just deterioration of overall health, usually attributed to a lack of self-care. So the chronic use of opioids, really neglecting to care for one's physical body, so failing to brush your teeth or your hair or eat proper meals, all leading to just worse overall health. There's a suppressed immune functioning with chronic use of heroin, engaging in risky behaviors in order to obtain heroin, or because of the diminished ability to make decisions, an increased risk of HIV and hepatitis due to needles, potentially, and then also impaired cognitive functioning due to loss of oxygen to the brain, or hypoxia. And that's it for the short and long-term effects of opioid use.